Welcome to our channel. Today we're going to talk about the main symptoms of diabetes in women. Before we start, I'd like to thank you for visiting and ask you to subscribe to the channel and give it a like. This helps us reach more people who need this vital information. Diabetes is a condition that affects millions of people around the world, and recognizing the symptoms early can make a huge difference to treatment and quality of life. Let's explore 12 warning signs that can indicate the presence of diabetes in women. We'll also find out how the US has implemented initiatives to combat this epidemic. Get ready, some of these symptoms may surprise you. 1. Excessive thirst and frequent urination. One of the first signs of diabetes is excessive thirst and the frequent need to urinate. This is because the body is trying to get rid of excess sugar in the blood. When glucose levels are high, the kidneys work harder to filter and absorb the excess, which leads to increased urine production. This, in turn, increases thirst, as the body needs to replace lost fluids. Scientific studies indicate that polydipsia, or excessive thirst, and polyuria, which is the urge to urinate frequently, are among the most common and early symptoms of diabetes mellitus. A study published in the journal Diabetes Care revealed that more than 60% of patients newly diagnosed with type 2 diabetes reported these symptoms. In addition, the constant need to urinate can lead to dehydration, further exacerbating the feeling of thirst. Excessive thirst and frequent urination are often underestimated, but they are crucial signs that should not be ignored.
Please subscribe and click like. Help our channel bring this information to more people who need it.
2. Unexplained fatigue. Feeling tired all the time, even after a good night's sleep, can be a sign of diabetes. The body is unable to use glucose properly to generate energy, resulting in a constant feeling of tiredness. This symptom is often mistaken for stress or overwork, but when it persists, it can indicate more serious problems. Unexplained fatigue occurs because, in diabetes, the body's cells cannot obtain enough glucose to generate energy due to insulin resistance or a lack of insulin. A study published in the Journal of Diabetes and Its Complications revealed that 80% of patients with diabetes reported chronic fatigue as one of their most debilitating symptoms. This is because glucose, which is the main source of energy, is not being used efficiently by the body. Fatigue can severely impact quality of life, making daily tasks difficult and compromising productivity. If you are experiencing this symptom regularly, it is important to seek medical help for correct assessment and diagnosis. 3. Unintentional weight loss. Losing weight effortlessly is a warning sign. When the body can't use glucose as an energy source, it starts burning fat and muscle, leading to weight loss. Studies show that unexplained weight loss is common in cases of type 1 diabetes, but can also occur in type 2. The weight loss process occurs because, without enough insulin, the body can't use glucose for energy and therefore starts breaking down fat and muscle for fuel. This results in significant and rapid weight loss, often perceived suddenly. Research published in the American Journal of Clinical Nutrition highlighted that weight loss is one of the most common initial symptoms in newly diagnosed type 1 diabetes patients. This symptom can be particularly worrying in women, as it can be confused with other conditions, such as eating disorders or thyroid problems. It is crucial to consider the full context of the symptoms in order to reach an accurate diagnosis. 4. Blurred vision. Blurred vision is a common symptom of diabetes and occurs due to changes in fluid levels, which affect the eyes. This may be temporary, but it is an important sign to consider, especially if it occurs frequently. Hyperglycemia, high levels of glucose in the blood, can cause changes in the lens of the eye, resulting in blurred vision. These effects are usually reversible with proper control of blood sugar levels. According to a study published in Diabetes Research and Clinical Practice, blurred vision is one of the first eye symptoms reported by patients with type 2 diabetes. It is essential to pay attention to any changes in vision, as diabetes can also lead to more serious complications, such as diabetic retinopathy, which can cause permanent vision loss if not treated properly. 5. Frequent infections. Women with diabetes are more prone to frequent infections, such as urinary infections, candidiasis, and skin infections. Excess sugar in the blood creates a favorable environment for the growth of fungi and bacteria. Studies show that high blood glucose levels compromise the immune system, making the body more susceptible to infections. A study in the Journal of Women's Health found that diabetic women are twice as likely to develop urinary infections compared to non-diabetic women. Candidiasis, a common fungal infection, is also more prevalent in women with diabetes due to the moist, sugar-rich environment that promotes fungal growth. Preventing and controlling these infections involves properly managing blood sugar levels and maintaining good personal hygiene. Seeing a doctor regularly and monitoring your health is key to avoiding further complications. 6. Wounds that take a long time to heal. Slow healing of wounds is a worrying symptom of diabetes. High blood glucose levels can damage nerves and blood vessels, hindering the healing process. Diabetes can cause poor blood circulation, which results in insufficient blood flow to the affected areas, slowing down healing. In addition, hyperglycemia can impair the function of immune cells, hindering the body's response to infections and injuries. A study published in the International Wound Journal revealed that diabetic patients have a significantly higher risk of developing foot ulcers, which take a long time to heal. It is crucial for women with diabetes to take good care of their skin and monitor any cuts or wounds. Consulting a healthcare professional at the slightest sign of infection or slow healing can prevent more serious complications. 7. Tingling in the hands and feet. Tingling or numbness in the extremities is a sign of diabetic neuropathy, a complication of diabetes that affects the nerves. This can start as a mild tingling sensation and progress to severe pain. Diabetic neuropathy is caused by high glucose levels that damage the nerves over time. A study published in the Journal of Diabetes and its Complications found that around 50% of people with diabetes develop some degree of neuropathy. This nerve damage can result in pain, loss of sensation and weakness, making daily activities challenging. It is important for women to monitor these symptoms and seek early medical treatment. Proper diabetes management can help prevent or slow down the progression of diabetic neuropathy. 8. Dry and itchy skin. Dry and itchy skin, especially on the legs, can be a sign of diabetes. The condition can cause skin dehydration and circulation problems, resulting in persistent itching. The poor circulation associated with diabetes reduces the skin's natural moisture, leading to dryness and itching. In addition, high blood glucose levels can cause inflammation, aggravating the skin condition. A study in the Journal of Dermatology indicated that people with diabetes have a higher prevalence of skin conditions, such as xerosis or known as dry skin, and dermatitis. To alleviate these symptoms, it is recommended to use specific moisturizers and maintain good control of glucose levels. Consulting a dermatologist can help manage the condition more effectively. 9. Increased hunger. Feeling constantly hungry, even after eating, is another symptom of diabetes. The body is unable to use glucose from food efficiently, leading to a feeling of persistent hunger. Constant hunger, known as polyphagia, occurs because the body's cells are not getting the energy they need from glucose. Even when eating large quantities of food, a lack of insulin or insulin resistance prevents glucose from entering the cells. A study published in the American Journal of Clinical Nutrition highlighted that polyphagia is one of the classic presenting symptoms in patients with type 1 and type 2 diabetes. This symptom can lead to weight gain and other complications if not treated properly. A balanced diet and proper diabetes management are essential to control this symptom. 10. Dark spots on the skin. Dark spots, usually in the folds of the skin such as the neck and armpits, can be a sign of insulin resistance. This symptom, known as acanthosis nigricans, is common in people with diabetes. Acanthosis nigricans is characterized by areas of dark, thick skin, often accompanied by a velvety texture. This symptom is often associated with insulin resistance, a condition in which the body's cells do not respond properly to insulin. A study published in the Journal of Clinical Endocrinology and Metabolism noted that acanthosis nigricans is an early indicator of type 2 diabetes and is often present in obese people. It is important to monitor these skin changes and seek medical advice, as they may be a warning sign of diabetes or other endocrine conditions. 11. Mood swings. Mood swings, including irritability and depression, can be associated with diabetes. Blood glucose levels affect brain chemistry, impacting mood and emotional well-being. Fluctuations in blood sugar levels can cause rapid mood swings and feelings of irritability. In addition, the stress of living with a chronic condition can contribute to anxiety and depression. A study published in Diabetes Care found a significant correlation between diabetes and mood disorders, highlighting the importance of psychological support for diabetic patients. It is essential that women with diabetes receive adequate emotional and psychological support. Support groups and therapies can help manage these symptoms and improve quality of life. 12. Concentration problems. Difficulty concentrating and slow thinking can be signs of diabetes. The brain needs glucose to function properly, and unstable blood sugar levels can affect cognitive ability. Hyperglycemia and hypoglycemia, low glucose levels, can directly impact brain function, leading to concentration difficulties and memory problems. A study published in Diabetologia indicated that patients with diabetes often report cognitive difficulties, which can be aggravated by repeated episodes of hypoglycemia. To manage these symptoms, it is crucial to keep blood glucose levels stable through a proper diet, regular exercise, and medication as prescribed by a doctor. Some data on diabetes rates around the world. According to the International Diabetes Federation, IDF, the country with the highest rate of diabetes in women is Kuwait. It is estimated that around 25.4% of women in Kuwait live with diabetes, an alarming figure that reflects the public health challenges faced by the nation. Factors such as a diet high in carbohydrates and a sedentary lifestyle are pointed out as the main contributors to this high prevalence. A study published in the International Journal of Environmental Research and Public Health highlighted that rapid urbanization and lifestyle changes have contributed significantly to the increase in diabetes cases in Kuwait. The study suggests that interventions focused on education and the promotion of a healthy lifestyle are essential to combat this epidemic. On the other hand, Iceland is one of the countries with the lowest rate of diabetes in the world, especially among women. It is estimated that the prevalence of diabetes in Iceland is significantly low compared to other countries, due to several beneficial factors. The Icelandic diet, rich in high-quality fish, fruit, vegetables, and dairy products, plays a crucial role in maintaining health and preventing diabetes. Fish, in particular, are rich in omega-3s, which have anti-inflammatory properties and can improve insulin sensitivity. In addition, the Icelandic population leads an active lifestyle, with high levels of physical activity, which helps to maintain a healthy body weight and regulate blood sugar levels. A study published in Diabetes Research and Clinical Practice highlighted that Icelanders have a balanced diet and lifestyle that contribute to the low incidence of diabetes. Public health policies in Iceland also encourage regular checkups and health education, helping with the early detection and prevention of diabetes. In the United States, diabetes is a prevalent condition among women. According to the Centers for Disease Control and Prevention, CDC, around 13 million American women have diabetes, representing a significant portion of the population. This figure reflects the urgent need for preventive and control measures. A study in the Journal of the American Medical Association highlighted that the prevalence of type 2 diabetes among women in the U.S. has increased dramatically in recent decades, partly due to factors such as obesity, a sedentary lifestyle, and a diet high in sugars and fats. In addition, African American, Hispanic, and Native American women are disproportionately affected, indicating significant health inequalities. To combat this epidemic, the U.S. government has implemented several initiatives. The National Diabetes Prevention Program is a collaboration between community organizations, health centers, employers, and health plans to offer weight loss and healthy lifestyle programs. This program aims to reduce the risk of type 2 diabetes through education and ongoing support. In addition, the Affordable Care Act, ACA, included coverage for preventive services at no additional cost, such as diabetes screenings and diet and nutrition counseling appointments. These policies are essential to identify the condition early and help women manage diabetes effectively. Preventing diabetes is essential to maintaining a healthy life. Adopting a balanced diet and exercising regularly are fundamental measures. Apples are a fruit that can help prevent diabetes due to their low glycemic index and high fiber content. In addition, cinnamon tea can be an ally, as it helps regulate blood glucose levels. Scientific studies show that the Mediterranean diet, which is rich in fiber, healthy fats, and antioxidants, is effective in preventing diabetes. A study published in the New England Journal of Medicine showed that this diet can reduce the risk of type 2 diabetes by up to 30%. The inclusion of foods such as nuts, olive oil, and fish can have a positive impact on health. Maintaining an active and healthy lifestyle is crucial. Regular exercise helps to improve insulin sensitivity and control blood glucose levels. A study carried out by the Diabetes Prevention Program revealed that regular physical activity can reduce the risk of diabetes by up to 58%. Recognizing the warning signs of diabetes is crucial for early diagnosis and effective treatment. If you have identified any of these symptoms, consult a doctor for a detailed assessment. Thank you from the bottom of my heart for watching this far. I hope this information has been useful and inspiring. Please don't forget to like and subscribe to the channel. Comment below on which tip you found most useful. And don't forget to check out our next video on the nocturnal signs of diabetes that should not be ignored. Until next time, take care.
Thanks for watching. We love that you're joining us. Subscribe, explore our channel, watch more videos, and embark on your journey to wellness with HealthToday.